Good afternoon, everybody. It's welcome to our bi-weekly webinar. It's Friday, September the 11th of 2020. Thank you for joining us today. And as usual, we hope that you and your families are staying safe and employees and returning to work, I guess, as HR allows you to in a safe manner. We want to keep you up to date with what's going on in the industry with COVID-19, of course. And we'd be remiss if we did not mention that our hearts and prayers go out to those that were affected in the September 11th attacks that went on, and hopefully that you're finding the strength each passing day. It's very similar to what we're facing now. On a little different scale for sure. These things are historic in nature, and they'll continue to be probably, things that we deal with as we go forward. And just stay safe, and it'll get better when we come out on the other side. Today's remarks in the news. The education system seems to be making the news media today, whether it's good or whether it's bad. We actually made some good press with a school board in Calgary this week, as a matter of fact, that we're proud to be using our Enviro Solutions disinfectants through dispensing and dilution control devices and our hand sanitizer, our Serve Clean line. So that's good. But there's a lot of bad news there, and some countries are actually doing better than others. Parents still struggling with should they send their children back to school, should they not. There's been some school boards across North America that have decided that they're okay with opening. Some have opened actually as recent as this week. Some have delayed it until next week, really to prepare properly. And, I think it's a good thing, maybe taking an extra week or so to prepare and make sure that everybody's safe there. Public fatigue is certainly impacting our world without doubt. There's a lack of patience is evident whether you're driving in the car or going into a store. It's just there needs to be a higher level of tolerance, I guess is what I would say, and that's up to each one of us. As I say, look in the mirror each week there. We've got to find ways to spread that kindness and make sure we're staying safe and doing everything that we each individually can do to make it a safer, better planet. Marketing world, up with products and development seem to be, just going absolutely overboard with false claims for disinfectants. And, I mention each week these knives and spears and all of these kinds of things that puncture cells. And then basically leave a residual matter that's good, that'll kill anything that comes even close to it for 9 months, 7 months, and 7 days, whatever. Beware of those things. If it sounds too good to be true, it most likely is in every single case. And if you thought that was a solution, if the world did, the whole entire world would be engaged in making sure that they had those particular wonderful products in their facility, but it just really isn't the case there. But and especially when it comes to disinfectants, without doubt. Vaccines well underway. It looks to me like clinical testing is advancing every day, and from what I see from the medical scientists and the doctors and things, it looks like about Q1 in January, February, March of 2021 for the earliest, and that's a good thing. I know they're down to human testing now, which really is the proper protocol to make sure that once you start taking a vaccine, it's going to help you and not really harm you. So that's really, you can't just make vaccines overnight. It's like we can't make disinfectants overnight. You have to do the proper protocol and testing and validation and measuring to make sure that it does that. It's predicted, though, that the vaccine will probably be an annual treatment. In fact, some people I've heard it's going to be biannual even, and the world really doesn't know yet, but it's like the flu shot. We started off with the flu shot, I don't know, probably 10 years ago. Some of humans bought into it, some didn't buy into it. Believe me, according to our medical experts here, the widespread vaccine uptake is the best shot at having and regaining some of what we've lost, with returning things to what we cherish. Things like holding, family and friends closely, having community events, and living our lives without the fear of contracting the disease. It is stated with medical experts that we will probably have to vaccine our way out of this, and you know what? That's a good thing without doubt there. While North America predicts a possible double whammy this fall with COVID-19 and the seasonal flu combining, maybe mutating, a hybrid, whatever it is. I just want to talk about, this is all bad news, but the good news here is the Southern Hemisphere, which is really in their fall and winter already, have been investing in cleaning and disinfecting and hand sanitizer and masks and social distancing and things. And I'll share some numbers with you here. Chile recorded 1,143 seasonal respiratory infections this year versus 20,949 the same period last year. This is the Southern Hemisphere, okay? Australia had 84 influenza cases in the last 2 weeks of June this year versus 22,000 the same period last year. New Zealand clinics reporting 90% fewer cases in influenza and the flu this year. And the number of flu cases in Argentina have fallen 64%. That's our Southern Hemisphere. They're ahead of us with their winter and fall versus North America, and I'll say North America in this particular case. So we look at that and say, well, has the news, has the education, has the general awareness of COVID-19 and how to lower the risk, is that paying off? Right? The investment in proper cleaning protocol, disinfecting caringly, thoughtfully, sparingly in those high contact, high risk areas, social distancing masks. I think they're maybe onto something here, So I just like to report a little good news once in a while as well, instead of all the bad news there. So why are some of those other cases? The majority are getting flu shots. There's been a dramatic increase in that, right, as well. So when it comes down to your family and your businesses and your HR policies and things, gather all your due diligence there and make a proper decision as to whether you endorse it or whether you don't or whatever. And that's everybody's individual thing, but I can tell you it's probably not a bad thing to consider. Our critical role is really providing the education that assists you with lowering the risk of an outbreak. That has been since day one, since we've started these, and that's really what it is. And then pre-planning, cannot stress enough that you ensure you have extra inventory on hand, particularly disinfectants. We've been warning people, advising people for the last month or so. We've ramped it up a little bit. There will be a shortage of dilutable disinfectants in the marketplace. The raw materials, whether they're quats or sodium hypochlorite or peroxides or whatever the nature of the disinfectant is, believe me, there will be shortages, okay? So heed that advice. Governments have placed massive orders to support the education sector business, which have used up some of those things. You'll have distributors out there. I know we will deal with distributors and that as well. You can predate orders, right? So if you wanted a shipment of a disinfectant like ES364 or ES15 or whatever it may be, October the 15th, November the 15th, December 1st, whatever, we will do our best to work with you to make sure that you get it. But what we don't want to do is basically have you place an order, not heed this advice, and us give you the bad news that, sorry, we can't do it, okay? We don't want anybody to be in a position, and we'll be in allocations and things like that. Obviously, as we move towards falls, more panic could set in, unrest could set in, and just heed that advice. So I think before we begin today's session, we've had a small video from UNICEF come in, and it's in a cartoon format, and we're going to play that actually before we start today's session there. So it's about a minute long there, and it really drives home the importance of wearing a mask, and it's a great video to play to your children, to your families, to your workforce, or whatever it may be, and I think you'll enjoy it. So just stay tuned here for about a minute. Okay, welcome back. Hopefully you enjoyed that little video there, and I think it really drives home the message about the importance of wearing a mask, and it's great to share with your family members and coworkers and all of those things there. So again, just enjoy that and get some mileage out of that. When I come up here, this is every single week. You don't need to know more about me, that's for sure. You can revisit the video if you want to read that. This week's discussion points, obviously keeping our theme of cleaning protocols to lower the risk of an outbreak. And thank you for all of your positive comments that come in to say, thanking us for actually putting this together. There is a lot of work behind the scenes for sure, and it's just our way of giving back and really following our mission of Charlotte Products. They are bi-weekly. The next one is September the 25th. That one's going to be an exciting one. I'll talk about at the end, give you a little bit of information as to what's coming up there. Today you'll see we're going to talk about sustainability, and there's a recent poll survey from the United States that I wanted to share with you. And what's really good is it's good news we're talking about maybe sustainability in different words now instead of just always COVID-19. And I think what's driven this is the vast amount and increase in wet wipes and plastic containers and all of those things are really affecting our planet and sustainability and landfill and all of those things. So it's good to sort of bring you up to speed as to what the people are thinking out there. Industry knowledge. You've been asking for more information about safety data sheets. Our weekly questions that come in, you've been bombarding us with those, and we want to talk to you about common sense. And we actually have our regulatory compliance officer, Rebecca Oosting, in here with us today, and she's going to join us for that session to help give you some clarity on more information there. And obviously you can continue to ask questions, and we'll have an open mic at the end with Rebecca and Askwith and myself, as we typically do. So really talking about sustainability and gaining momentum, and right in the middle of COVID-19. I mean, what does the word sustainability mean? In my personal opinion, it means caring about our future today. There's no sense caring about it in another 100 years or so, because we could be in worse shape than what we are, and what we did up till yesterday doesn't matter. But I mean, what we're doing about it today is critical, right? And there is a new survey out here, Genomatica. This was June of this year, 2020. Shows that sustainability has moved from a fringe preference into a core imperative across North America, okay? And really, the top of mind issues for 85% of the respondents indicated that there's less traffic, cleaner air, but there's huge amounts of plastic waste. And that's a serious thing that we have to deal with, right? 86% of the Americans say sustainability will be equally or more important when the pandemic subsides. I agree. 48% are inspired to find new ways to keep being sustainable and increase. That is a good thing for every one of us. 42% realize that being sustainable is easier than they thought. Right? And you would think that we struggled 20 or so years ago with just a blue box recycling program at each one of our houses there. I mean, look how easy that is today and how commonplace it is today. So everything we learn today and tomorrow, I do honestly believe with these people agree with 42% that it will be easier than you think it will be. 59% say working from home is more sustainable than working in an office. Large square footage, heating, air conditioning, lighting, energy, all of those particular things, it's very obvious, even the traffic on the roads and things like that with petroleum, electric batteries, whatever it is, transportation, all the maintenance on vehicles. I mean, there's no doubt that 59%, in fact, if I would probably think that it was higher. 68% buying less stuff. And I mean, this is very true, throwing fewer things away and not commuting or flying. And for those of you that know me, I haven't been on a plane since March the 3rd, and I do not miss it, to tell you the truth. 37% of Americans willing to pay a little bit more for sustainable products, even during an economic downturn caused by COVID-19. I would like it to be higher. I'm sure it will be higher, but that's a good thing. We're trending in the right direction. Gen Z is the most willing. Obviously, Gen Z is the younger people that are more, I guess, educated with sustainability and things, and they know that if they don't do something today, they could have a negative downturn in the beginning. So they're participating there. That's extremely good. 32% of Americans buying more sustainable products. I know our family. Definitely, when we make decisions, we buy more sustainable products without doubt. No, we try to stay away from disposable and all of those particular things there because it's the right thing to do. So half of the people here are there. 50%, okay, are researching for safer cleaning products to use and to be safe. We talk about RDS Sheets in a little bit there. You'll start to understand, and we've always talked about safer cleaning products, reducing the amount of products that you consume, the reduction of poisons and toxins in the air and all kinds of things like that, better air quality. I mean, this is good. And 50% are more comfortable using reusable grocery bags, and 60% will use them as soon as the stores are able to provide them. I mean, when we first went to paper bags, we had paper bags, then we went away and we had complaints, then we had the little t-shirt plastic bags, and people complained, and now they need them, and now they take the plastic bags away, and then the consumers complain because now we got to go back to reusable bags, then we go to reusable bags, and then COVID-19 hits, and then the stores won't allow you to come in with them. You've got to disinfect and do whatever, so now we're back to paper bags and all those kinds of things. So the stores are ramping up as fast as they can, but these are key study results that actually bode well for us in the future there. And some real thoughts for cleaning and disinfecting, because this has been one of the big questions that we get weekly. Pre-cleaning and then caringly, thoughtfully, and sparingly applying a disinfectant to those high contact, high risk areas is really our goal. That's our directive to you. There's been a lot of people out there that honestly believe they can only pre-clean using a disinfectant. And that is not indeed the case. If in infection control in a facility dictates that, you always follow that. But you can you can satisfactorily pre-clean surfaces with a good quality cleaner and then disinfect accordingly. Right? So I wanted to clear that question up there. The attributes of using the right general purpose cleaner: safer. It improves employee wellness. There's fewer complaints. There's fewer issues with absenteeism, with eye irritants, with skin irritants, with respiratory ailments, right? I mean, that reason alone would be a good reason why to choose a good quality detergent to pre-clean surfaces, right? Less expensive. Budgets are going to be an ongoing issue for several years to come, we predict, and if you could cut the ready-to-use cost in half by using a good quality pre-cleaning detergent as opposed to a disinfectant all the time, then why wouldn't you do that? Right? Higher dilutions. Generally, some disinfectants will dilute fairly low, so your ready-to-use cost is high. GP cleaners generally dilute much higher, so again, lowering your cost, but also putting fewer or less plastic containers in the landfill, which is a much more sustainable, direction to go. And the cleaning performance overall will usually be superior than over disinfectants because the chemistry focuses on detergency and cleaning as opposed to disinfectant claims. So there's a big difference there. So why wouldn't I use that? Probably because you don't know some of this information. But what we do have is, as you know, we have our dispensing system, our Enviro Solutions ES72, which is our pre-cleaning detergent, which is used at three different dilution ratios. I'll just explain: light duty, medium duty, and heavy duty, to clean and disinfect about 95% of anything you would need in your facility. So we pre-clean using a lower cost, safer detergent for a multitude of cleaning tasks, and then we encourage you to use our ES64, 64H, or our 364 to disinfect caringly and thoughtfully and sparingly. If you have not looked at this system, you absolutely owe it to yourself to look at this. The cost is dramatically less, right? The benefits: safer, improved employee wellness, no chemical contact whatsoever with concentrate formulas, very substantial claims for peace of mind disinfectant against a multitude of bacteria and viruses, including effective against COVID-19. Improve sustainability, less plastic in the landfill. The absolute lowest cost you could probably get, which will have a great positive impact on your budgets, right? Extremely accurate dilution. For those of you following our webinar series, we know we've actually done demos where we've glugged and poured and all those kinds of things. You cannot afford to do that anymore, simply because of budgets, sustainability, health and safety, waste of detergent, all of those. But the list could go on. I could talk about it 20 minutes, right? So, and when it comes to disinfecting, if you do not meet the criteria, the exact dilution, less will not allow you to have your end result, and more is the same thing. So it needs to be accurate, right? You'll get a better overall clean, you'll have labor efficiency there, and it's really not a question of whether you need dilution control or not. It's which system best suits your facility. So imagine this. We have two concentrated products that will effectively clean up to 95% of any single need you need in your facility. Imagine that, 2 SKUs, right? Lowest cost, all of those things. ES64H, I know Asquith and I talked about this a little bit in the past. This is our latest product that comes to Canada. It's been in the US for several years now. It is now on the Health Canada list. It is going into production. Actually, it went into production this week, actually, as a matter of fact. Costing is going out as well. It'll be very similar to our original ES64 solution and formula, although it is on the Health Canada list and it has better microbial efficacy overall. So it'll be very similar, but it's our latest step in COVID-19 registered products, as a matter of fact. Goes in the same packaging, the same dispensers, the same entire thing there, so it's a seamless transition for you. For those of you that want to talk about price, I know we put price in here a little bit before, and if I look at this here, I mean, how much would you pay for a heavy duty spray and wipe cleaner with a bottle and a trigger, that you would run around spraying, like degreasing or spraying and wiping or whatever? I mean, the most expensive cost here of ours, I mean, that could be $3, $4, $5, $6, $7, $8, $9, $10, $15. Our cost here, most expensive, is $1.28 a bottle, right? You cannot compete on a budget with that. So it is by far the lowest ready-to-use cost. As a reminder, weekly, bi-weekly, we always do this because it's one of the key questions. And by the way, keep submitting your questions because what drives us to do these things. And it's amazing how popular or how similar the questions are, which means you're all thinking in the same positive way. But when you're using a disinfectant, the proper protocol is this. Make sure it's registered. Make sure you read and understand the label. Make sure it's diluted properly. More is not better. Less is not better. Make sure it's exact. Regardless of your delivery method, whether it's a fogger, a mister, a pump-up sprayer, a trigger bottle, a charge bucket, whatever it is, it doesn't matter. Always pre-clean surfaces of growth, filth, and debris. Okay, that way your disinfectant comes in contact with the surface as opposed to being somewhat held back from killing the bacteria and viruses or eliminating it there by getting sort of tied up trying to eliminate the dirt and debris that are there, and so you'll get a cleaner result. Respect the dwell time and make sure around food contact surfaces you have a potable water rinse. Okay. The Golden Bill, by the way, is making its appearance this week. I forget who won it 2 weeks ago there. I know it was Town of Ajax for sure. And I think there was a finance director from a large distributor across Canada that won it as well. I know his name was Brock, and he won it, and he was thankful there that he got it there. So it's up. First one that writes in and says, I would like the golden $100 bill, obviously gets it there. And I think we've given away around 20 of them right now, so that's there. And then when it comes to an SDS review, and our question and answers today are going to surround that. But here's what I'd like to say. This is an SDS review for our Enviro Solutions 77 NFP no flash point glass cleaner. And you can see on the right that it's clearly rated a 2. And why do we rate these things? Why do SDSs exist? They're really for your safety, right? But we put honest warnings following the criteria. Our regulatory compliance people put them on there. They are there indeed to protect you. That is it. We could lower these ratings all day long and put a 0 on there, whatever it is. But what happens in our world today is when a health and safety issue happens, an illness happens, a loss of life happens, there's a liability trail that's there. We will never ever lower these ratings if there's a remote chance of something happening. So we actually put this, but so this is a glass cleaner, and this is no flash point, so this is lower levels of alcohol, methyl hydrate, ammonia, whatever it is that's in them, okay? So the probably one of the safest glass cleaners you could get, and it's rated a 2. Now here's one that I'll tell you, this is a competitor's cleaner disinfectant. This is one that they're talking about with the knives and the spears and all this residual and everything else that'll keep you safe for 7 months, so don't worry about anything else, right? You're good. Rated absolute zeros. So this is a poison. This is a toxin, no matter what way you look at it, because it eliminates bacteria and viruses, okay? And it's rated a 0. And what we get challenged with is how can these people get away with rating lower numbers? Okay, and we're going to get to our question and answers, and we're going to talk about that. But I just sort of wanted to do a prelim on that for you to sort of set the stage. So before we get to the questions, this is our 24th webinar. Ask with, he still thinks he's on 5, so we won't tell him any different, so he'll keep coming back and doing them. Thank you for your valuable time. We're going to continue bi-weekly. The next one is Friday, September 25th at 1 o'clock EST time. The topics will obviously be the most recent COVID-19, but this time here, we have a special mystery guest that's coming. That is top secret. There's only 2 people that absolutely know. I'm not even going to tell you who the second person is there, because then you'll be asking that person for the clues. But this panel will give you a total different perspective on what's going on in the industry from a level that you will never ever expect, right? They're going to tell you the good, and they're going to tell you the bad. They're going to tell you the changes that have done and what they've experienced, I mean, this is unbelievable, this, okay? So anyway, with that being said, let's move along. We'll get to our questions and answers. Oh, good afternoon, Asquith. How are you this afternoon?
We are well. How are you, sir?
Jeez, I'm telling you. September the 11th now. Long weekend just happened. How was your long weekend?
It was quiet, Jimmy.
Quiet?
Very
Yeah,
quiet.
you said that about the one in May and the one in August and July and everything else. There's what you said there.
I'm just trying to social distance, Jimmy.
Just a quiet guy is what you are there.
And social distancing.
Yeah. Well, that's good. Well, thanks for, as always, for coming in today. We've got Rebecca with us today, Rebecca Oosting. She's our Regulatory Compliance Officer. Thanks for joining us today, Rebecca.
Thanks for having me, Jim.
Yeah, I didn't think Asquith would be able to convince you to come in, and there was a little reluctancy, I believe. But
I tried hard, Jim.
Yeah. But Rebecca's been with us about a year now, as a matter of fact, and she's really in charge of regulatory compliance. And all of your questions that come in to the sales force in general and the order desk across the board, those technical questions all get referred to Rebecca, and we thought it would be great to have Rebecca join us today. So you could, if you're talking to her or through an email, you'd get to put a face with an email, or
Sure.
whatever it may be there.
Yes.
So thanks for joining us today. You're doing a great job behind the scenes there, and you probably don't get thanked a lot, and you probably get more questions and issues than
For
you
sure.
do the other there. So that's good there. So Mr. IT Director, do we have questions today? Thank you very much. Okay. Oh, these look, as you know, we don't see these until they come in. And it looks like you're in trouble today. This may not be a good day for you, Rebecca, there. So 24th webinar.
No way, Jim.
Yeah, 24th. I know we fooled you by saying we'd only need you for 1 or 2, but now it's number 24. You believe that, Rebecca?
It's unbelievable.
Yeah, it is. And you know why we keep doing it, obviously, is because the customer asks us to. And they always ask these questions, and good common sense questions. And unfortunately, there's some people out there that are misleading, and we're certainly not that. And we believe in integrity, and that's really what we're
That's what it's all about.
What we're about with it, without doubt there. So, we've talked about last webinar about cleaning and disinfecting buses. We've talked about the delivery methods that really are with sprayers and foggers and misters and all of those things. And the world all of a sudden, for lack of a better word, went a little offside with blatantly just spraying massive disinfectants in the air, whether robotically or whatever, and not following any of the protocol, just like a machine in a bus, Rebecca, that basically just sprayed a disinfectant and not pre-cleaned, who knows the dilution, and just sprayed everything. The windows, the roof, the seats, the aluminum, the driver's compartment, that's not right. That's really not right unless you follow that protocol. But what's been good about that, because I always believe in learning as each one of these cases come by, we've had more emails this week than in history about the safety of using disinfectants in these applications. SDS sheets having strict warnings on there. They're there for a reason, and we'll talk about that today. So what's good about it is, it's good that people ask questions and get the right information to make an intelligent decision for their facility.
Absolutely.
Right?
Yes.
And that's really what it's about. So that leads us into things there today. So first question here is Peter D. Can you explain what information is on an SDS sheet and how does it differ from the original WMIS from back in 1987 or 1988, whatever year it was there? Which one do you want to answer that question?
You want to take that one?
Well,
Rebecca?
there's several differences that you can see. They changed the symbols up.
Yes.
They made it more streamlined and more structured so that the average person could be able to understand it. And they globalized they harmonized the whole system so that each country could have this same sort of structure. So no matter whether you're from the US or from Canada, you have the same structure and be able to identify the things that you needed to know about the material in question.
Yeah, so a worldwide standard there. I guess any country in the world now. I think it
Yes.
stands for Globalized Harmonized System. Is that what it sort of
Correct.
stands
Correct.
for?
Yes.
So everybody's following the same
Yes.
criteria.
Same rules,
Yeah,
yeah, for
So
sure.
that's excellent. So is it?
And that improves safety across the board.
Oh yeah, it would, and it would streamline it. I
Yeah,
guess is what
yeah.
it would do, and bring everyone in there. So
Yes.
would it? Here's another question. Here's George. What is the purpose of an SDS sheet? They appear to scare people more than assist them to make proper safety decisions in the workplace. So why so many warnings, and are products actually more dangerous these days than they once were?
Well, really, one could say, really, it's all about user safety, and you want to make sure that the user understands that these are chemistries, these are products that could harm you, and you have to respect the products.
Yeah.
You got to wear the proper PPEs, you got to dilute properly, you got to wash your hands after using, you don't eat while using the products. All these things, they must be on that document to ensure that you go home to your family nice and safe every day. And basically that's what it's all about. You want to add anything to that, Rebecca?
I don't think that the chemicals are more dangerous now or the products are more dangerous. I think it's just about more education for the consumer.
Exactly.
Before, your great-grandmother or your grandmother might have used bleach in everything that she possibly cleaned at home.
Yes.
Now we know that that's not a proper method of
Bleach and
disinfecting.
ammonia.
Exactly.
Yeah, actually, ammonia too, as a matter of fact.
Yeah.
So it's a matter of they didn't know any better,
Yes.
Yeah.
right? But now we're educating people so that they can make informed decisions.
Yeah, and I think basically the long and the short of too much of anything can harm you.
Absolutely.
I look at, Rebecca, what do you think of this? You go to the drugstore, you get a prescription medication, and now the pharmacist wants to actually talk to people in a certain case to make sure they understand how to take it and the side effects. But if you actually read that warning that's on the, not on the side, but it's about a 7-page warning about if you take this is going to happen, this is going to happen, you're going to grow 2 heads, you're going to, your head's going to fall off, whatever it may be. Is that overkill? Why all of a sudden did the medical people have to start doing that?
I think because they have to, again, same as an SDS, they have to educate the person of any possible outcome that could happen with it, right?
Yeah.
And you have to make the informed decision. Is the benefit going to outweigh the detriment that could happen if I took this medication,
Yeah,
right?
absolutely.
Same with the disinfectant.
Absolutely.
Is it going to be able to kill the microorganisms and maybe I have a slight irritation on my skin or something like that? The benefit's going to outweigh the detriment to
Yeah.
the person.
So the medication probably hasn't changed much. It's not more dangerous. It's just the warnings are
Yes.
there worldwide to prevent probably, well, illness and loss of life and probably litigation at the same time.
Yes.
It's probably fair to say.
Absolutely.
Right? I think more information is not to be used scary. It's just there that you can make an intelligent decision based on what to use and how to use and when to use and all of those particular
It's
things.
trying to
So-
make you a more informed consumer. Really.
yeah, okay. Here's one from Robert. The last webinar you mentioned SDS sheets and to watch for ratings, perhaps being misleading and rated lower than they should be. How can they get away with lowering a rating? And I think before I'll turn it over on today's presentation, I showed you an SDS sheet that had a glass cleaner, our glass cleaner rated as a 2 and a no flash point, so I know there's less ammonia or alcohol or methyl hydrate or whatever in there, and we rated a 2, and yet that poisonous disinfectant with knives and spears and all of those fighting mechanisms is rated as 0. So I think I'll expand on Robert's question there. How do they get away with that?
So there's no...
Go ahead.
sorry.
You go ahead. You go ahead.
There's no regulatory body. There's nobody policing the SDSs, right? There's nobody verifying that the SDS is accurate. So
How
there's-
can that be?
I think, unfortunately, too,
Yeah,
a lot of
exactly.
SDSs are written by marketers.
Correct.
Well, that's a problem.
You know,
Correct.
Yeah.
whereas
Yeah.
Trying to get the
you know,
sales.
trying to get the sales, exactly that. And we write the SDSs that we produce by chemists,
Yeah.
by people who know what's happening.
Yeah.
And so we pride ourselves by following the rules and the regulations. We spend a lot of money training our people how to write SDSs.
Yeah, yeah. And I know they're ever changing in the whole work. So I think my message, if I threw it out to the audience there, if there's anybody from a government official that if they wanted to expand a department that's in the best interest of health and welfare of the general population, they may want to start policing what's
Yeah.
written on SDS
Yes.
sheets.
Yes.
It doesn't. So is it fair to say, Rebecca, that I'm saying, well, you can write whatever you want and wait until you get caught by somebody one day?
Pretty much.
That's
Pretty
like
much.
that's like driving a car 40 kilometers an hour or 40 miles an hour over the speed limit and knowing you shouldn't be doing it, but one day you got to wait till you get caught. I would use that same premise there is what I would do, but
Exactly.
but that's just morally wrong.
It is wrong.
We could take a very aggressive cleaning product, degreaser, acid product, disinfectant, whatever, and you're saying we could rate it a 0?
Who's going to check?
Well, that would make my job a lot easier as Vice President of Sales if I could do that, because half of my calls these days are really fielding,
Exactly.
they're really fielding like, how come your rating is higher than others, right?
That's
And-
why we don't have marketing and sales.
Well, you
right?
got to help me,
SDSs.
you guys. I mean, obviously, I know you're against me here.
But you want efficacy on the
I
product,
want
don't you?
efficacy and I want safety.
Exactly. Exactly.
Charlotte Products,
Yeah.
the value we bring
That's what-
is what we do, and you
That's
know
what
what?
it's all
We
about.
will never apologize for that.
No, we can't.
I think so. I think the government should step in some sort of regulatory body. And if I look right here, and I had this actually for the presentation, I've got our ES364, which is our neutral disinfectant, registered with Health Canada, COVID-19 effect, all those things. Okay, and I look because these are half of the questions that I get, and quite honestly, today already I've probably had about 17 questions surrounding SDSs, and I look here. And I see the one for the concentrate, okay,
Yes.
which is an aggressive concentrate. And if you can see on the screen, maybe go up here. I mean, look at the warnings right here, okay? Look at the warnings, okay? Now, I got 2 nasty warnings here that mean warning, right? Basically, watch, health and safety hazard. That's in the concentrate. But in the ready to use, if I look at the same exact, section, there's no warnings whatsoever.
Right.
There. So obviously, I think the message here is, unless they're using it straight, there is a higher risk with straight. But if you're using it straight, you're doing it wrong.
Exactly.
And the risk is lower in
And
ready to use.
I brought in a sample of a diluted version of those concentrates.
Oh, okay.
Okay?
Yeah.
So, for instance...
How did you know to bring those in? You just thought I was going to ask you.
Well, something, Jim? I think last webinar, we talked about dilutions and testing dilutions with different strips to make sure that you have the right concentration to do the job. Right? So I took the liberty of bringing some in. It's a good thing you brought that up.
Good.
If you look at this is a sample of ES 364. Now, in the formulation, you've got 87,700 ppms of product in here, right? In the concentrate. Hence the dilution that we talked about, right? So, once you dilute this thing 1 to 65, this is what you'll get. You get about 1,350 ppms, and I brought some strips in.
Okay.
And so
This is
you get
excellent.
your quart strip.
Yeah.
And Rebecca, you give me a hand here, please. And what we'll do, in the quart strips here, you'll just dip this in, and you're out, and then you can then look at this. You can see I've got all the different colorations here, and you can see we're right about spot on.
Yeah. Okay.
You see? And this should be done on a daily basis.
Yep.
Right? So you make sure that the efficacy is there, and you comply with the ready-to-use dilution that we talked about here in your SDS.
So your ppm is most important at
Very much so.
end-use dilution, and then also the reading and understanding the SDS sheet at end-use dilution is really two critical elements.
Exactly.
Okay.
And for our new ES64H, we've got 54,000 ppms.
Okay.
We got to remember that 1% is equal to 10,000 ppms.
Yes.
So, folks, 1% equals to 10,000 ppms. People in lab coats like Rebecca would say ppms, and the rest of us will say 1%.
Yeah, or parts per million. Don't forget parts per million.
Exactly, ppms, parts per million, right? So this one, the concentrate, as I said, is 54,000 ppms. When I dilute this down, as required by law, it comes out to 835 ppms. So you come up here and you can see this is 750. You can see that's right about there.
Yeah, you're right on. Yep.
And that's critical. That again should be tested on a daily basis.
Well, not just daily, but depending on the facility.
Well,
so if you're on your shift, for instance, as you go, if you're doing charge buckets, open charge buckets in a healthcare facility, I think infection prevention will ask them to do it every room or every other room or things. But but I look over your shoulder, you've got the dispensing device.
Come on in.
Yeah, okay. But you've got, I want to make sure I stay away from you. My 6 feet.
You're safe. You're
so
safe.
far we're
I
doing
understand
well.
that.
But if I look at that dispensing unit, I mean, that's all the more reason why you'd want a dilution control device.
Absolutely.
Because that comes out proven, tested to come out at the right dilution ratio, regardless of the water pressure and all of those things with the technology built in. So, why wouldn't somebody go with that?
This is where you need to go.
Yeah.
Push the button.
Yeah, for sure. Okay, well that's good to know there. Okay, but yeah, and are we required, Rebecca, by law to give SDS sheets in a ready-to-use format, or is that just over and above?
That's just our customer service aspect that we apply that. We're only required to give the concentrate because that's all we can control.
Yeah.
So what we manufacture is what we put in the bottle. That's the SDS that we have to provide.
Yeah.
But to help out with, schools and facilities that are using it, we do provide the RTU ones so that they can have some information.
Yeah.
But we can't always guarantee that they've made that dilution.
Well, then it becomes their liability, right? Once they're decanting something and away they go.
Exactly.
So, I mean, I don't know of very many that would even consider handing out an SDS sheet as far as that goes, without doubt there. So that's good there. Here's Donnie. I have an up-to-date SDS sheets in my facility, and I see major differences between the numeric ratings. I have a glass cleaner rated as 0, so I assume it's very safe, and I also have another glass cleaner with a 2. Comments there.
This goes back to the same thing you talked about in the slides earlier and what we spoke about already, is that each company is making their own ratings.
Yeah, okay.
Right?
Yeah.
And it's not regulated by
Yes.
any governing body.
Yeah, here he is here continuing. I have two disinfectants, one with more warning icons than the other, and one has a 0 as a number, and the other one has a 2. How can a disinfectant that eliminates harmful bacteria be rated safer than a glass cleaner? Is this accurate, or how can a disinfectant that's a serious product that eliminates bacteria be rated as 0? I think the same theme here, right? You know.
Well, and it can't be rated as 0. Think about what the job is doing of the disinfectant.
Yeah.
It's there to kill things.
Yeah.
So how can it be rated as 0?
Yeah, absolutely. I mean, that's what a disinfectant does, right?
No, granted though, there's some, some disinfectants that would have different actives. You can have a disinfectant that's based on quartz. You can have a disinfectant based on peroxide.
Yes.
Hydrogen peroxide.
Sodium hypochlorite.
Sodium hypochlorite. So all these things, right? Or even thyme oil.
Yeah.
So all that also has to be taken into consideration as well.
Yeah,
Okay.
for sure. Yeah, definitely. There. Here's Betty. It seems the theme goes on here. Are the numerical ratings on an SDS sheet different in the diluted format and lower than the concentrate strength? I think we answered that.
We
Yes,
went through that.
Betty,
The answer-
absolutely,
the answer is
absolutely,
yes.
they are, Betty, without question. Here's one that says, where would would water be dangerous over consumed? Would gasoline be rated dangerous? In the wrong mixture. I mean, imagine if water. Here's an open question. For Sam, if water was rated on an SDS sheet, where
Well,
You can drown.
you could.
yeah. Well, obviously
You
you
can drown
right?
with water. So
And believe it or not, water has an LD50.
Yeah.
An LD50 is where
Lethal
50%
dose.
exactly the lethal dose.
Yeah.
Where 50% of the population will, and of course water has an LD50. It's
Yeah.
a very large number,
Yeah.
but it's a number nonetheless.
But yeah, I mean, drownings are there. I mean, look at the skin irritancy, the eye irritancy. If you go in a pool or a lake and you open your eyes, I mean, it's an irritant. Your skin, I mean, that, what do they call that, crinkling? Or, if you're, when your skin crinkles when it's been exposed to water. There's a term for that. I forget what it's called.
I'm talking about even the consumption.
Yeah, no, the consumption.
You
Yeah.
can die by drinking too much
So I
water.
mean, so really,
There's an LD50.
what I'd like to say and get your agreement and buy-in. I mean, it's no matter what it is, it's to be used cautiously and not over, obviously an overabundance of using it and things like that.
Yeah.
If you had one glass of water or 2 glasses of water, I mean, you're great. But if you sat down and had a 45-gallon drum or a 210-liter drum, it wouldn't be good for you. The outcome,
exactly.
is what
Exactly.
it would be there. So common sense sounds like that. Does an SDS sheet list the ppm, the parts per million, for disinfectants on the sheets? And what's the range of ppm for quat disinfectants?
Well, the quat disinfectants the ppms vary, depends on the efficacy of the product. So, for instance, I just gave an example. ES 364, when ready to use, is about 1,350 ppms.
Yeah.
It has a different efficacy listing and also a dwell time. The ES64H is a different different active concentration, and likewise with the dilution factor is different as well. Where the ES65H, I think it's somewhere in the neighborhood of 835 ppms when ready to use.
Yeah.
Right.
Yeah.
So you can see it's the different concentrations to different jobs.
Yeah. Okay.
It's like having, let's look at it this way, different aircrafts carry some, smaller, some are larger, carry different passengers, different engine sizes. if you
I think here's John ties into the same thing. Does peroxide-based disinfectants ppm numbers measure the same as chlorine?
No. Most hydrogen peroxide products, to be considered the disinfectant, is around the 5,000 mark.
Yeah.
And we do have a sample here that we
Okay.
can check,
Yeah.
and we can see this. Because I brought that in because I thought perhaps we might,
Put you on the spot here.
and this is a big
Now,
sell for
Rebecca
us.
did this for you, didn't she?
Well, of
Because
course.
you wouldn't plan this.
No,
This
no,
is
no,
Rebecca
no,
coming in
Rebecca
and-
did that.
Okay.
And this this is quite interesting.
And this
actually.
is, what product is this, Aspen?
Hydrogen peroxide.
Okay.
Yeah,
okay.
ES 65H.
65H, yeah,
Yes.
okay.
So there's a little way to test this. You dip 1 second, you hold it for 60 seconds.
Okay.
Okay?
Well, that's how you do peroxide.
Yeah, so you do peroxide.
Good to
It's
know.
not an instant thing. It's a 60-second thing. And so I know it's going to be difficult for you to speak for 60 seconds, Jim.
Well, you know, I may struggle. You know, give me 45 seconds, I may be able to carry it on there.
So-
So sorry, just before you go on, so a quad is instantaneous.
Instantaneous.
And a chlorine is instantaneous,
Yes.
but a peroxide needs
Yes,
60 seconds.
60 seconds.
Wow, just like a food
Right?
service sentence.
But it's,
Good to
you
know.
make it nice and easy. It's right
Yeah.
on the label.
Well, you're supposed to read the label.
You can read the label. Read the label. Okay. So
Yeah.
so you can see.
Oh, I see it darkening
You
there.
see that?
Oh,
so
yeah,
now
okay.
you can see here that I've got the right concentration.
Yeah.
It's been
Yeah.
about a minute or so.
Yeah. Mhm.
And you can see that we've got the right concentration.
Nice. Okay. But that's good. Actually, I like
Right.
the fact that Rebecca brought those all along
Well,
for
well.
you there today. Aspen.
That means we got to bring Rebecca every week.
Well, there's no question. We'll invite her back,
good,
and
good,
that's for
good.
sure. I think we have time for about one more question,
Okay.
maybe two here. It's amazing how the time goes here. But here's Trevor. When will the product and pricing be available for your new ES64H disinfectant registered with Health Canada? I'll answer that. I think
Why don't you
I
answer?
did. Trevor, it's actually on the Health Canada list already. It has. It's been there, you know, for the last week or so, at least, and pricing is available any day. Probably. Well, today's the 11th, so probably I would say right after the holiday. And I know production. It went into production this week, as a matter of fact. And you've probably
That is
had
true.
to verify the test samples.
Yes,
and,
we've had to do our
all
first
the-
QC testing.
Yeah,
this
okay,
week.
good. So yeah, so your team actually does all the quality control and assurance too, right?
For
So
sure.
nothing gets into production unless you sign off.
And
That's
development may we add.
Yeah, good. Okay, so she's important.
Extremely
Yeah,
so.
well, that's good. That's good to know. So my closing remarks today are really, you know, keep watching, you know, keep encouraging us to continue with these, ask the questions. If you don't get the right answer or we don't quite explain it, ask again. You know, we're all humans here that'll really take the time out of the day to do that. And Rebecca, I'll just, before we finish with ask you, what do you think of your first involvement here? I know you didn't really...
Okay, but I'm usually behind the scenes type of person.
Yeah, you are, but you're okay. You handled yourself well, and hopefully we'll get some good positive comments back from that. But thank you, absolutely, because, you know, you're helping make it a cleaner, safe. And Asquith, I'll give you the last 30 seconds.
Well, I got 30 seconds. Thanks for coming by, Rebecca, helping us out here. And Jimmy, as usual, I always say, folks, social distancing, wear your mask, and keep washing your hands, and keep us all safe.
Yeah, absolutely. Stay safe, and
Stay safe.
until the 25th, we'll see you again. Thank you.